Good morning, everyone. It's my second lecture related to the anatomy of the kidneys, ureter and suprarenal gland or adrenal gland. Kidney in Japanese means genzo, ureter means nyoka, and adrenal gland means fukuje. We start with kidney. The kidney, as you see here, is retroperitoneal organ, which lie on the posterior abdominal wall. Here is the kidney. Here is one kidney here, and there is another kidney. So it's retroperitoneal, primary retroperitoneal organ. Means it's covered by here the parietal peritoneum of the posterior abdominal wall here. And you can see also other retroperitoneal structures here like abdominal aorta and inferior vena cava here. So when you peel the peritoneum from posterior abdominal wall, you can find here the retroperitoneal structures like kidneys, like suprarenal gland or adrenal gland here. Like here is a ureter here. Here is a ureter. Okay. So, and also you can find some muscles here, posterior abdominal wall. So here is posterior abdominal wall after removal of peritoneum or parietal peritoneum. The kidney could be called renal gland because it has hormonal function. It secretes a hormone called erythropoietin, which is important for RBC's production. So, but the main function, as you know, for the kidney is formation of urine. As I told you, kidney in Japanese, genzo, in Arabic, الكلى, ureter in Arabic called الحالب, and adrenal gland is called الغدة, الكظرية. If we say renal artery means artery which supplies, here is the renal artery, for example, here, and here is the renal vein. So, if we say renal vein, we say جين جامعكو, الشريان الكلوي. Sorry, الوريد الكلوي. If we say renal artery, for example, here, we say جين دومياكو, الشريان الكلوي. So Jaumiako means artery, Jaumiako means vein, Domiako means artery. So here is the learning objectives. You have to know what you have to know about the kidneys, for example. You have to study the morphology, location, relations, the neurovascular supply. That's important because relationship of the kidneys to peritoneum is important for extra or transperitoneal approaches of the kidney, or which access the kidney in various surgical procedures. Also, you have to know some related anatomical variations like horseshoe kidney, for example. Also, you have to understand the kidney has covering. And this covering is important to fix the kidney in position like renal capsule, pre-renal fat, renal fascia, para-renal fat. Also, you have to know the ureters. Of course, in this lecture, we will talk about the abdominal part of the ureter and points of constriction. These points are sites of stone formation. Of course, also you have to know the neurovascular supply and the lymphatic supply of ureter also and kidney. So you have to study regarding the suprarenal gland or adrenal gland. You have to know that it is embryologically from different sources. I mean, it has cortex developed from mesoderm and medulla developed from ectoderm. Also, the suprarenal gland has various blood supply. I mean, has 3 arteries which supply it from various sources. And also it has drainage which is different in right kidney in the right suprarenal gland from left one. The left suprarenal vein drains to the left renal vein, while the right suprarenal vein drains to IVC or inferior vena cava. So here is the kidneys. Here is the left kidney. As you see, here is the parietal peritoneum of here. Here is the parietal peritoneum here. Okay, and here is the visceral peritoneum. Here is the greater sac. Here is the lesser sac. Here is the spleen. So this organ, spleen, stomach, for example, is interperitoneal structures, but these organs here, all these organs here are retroperitoneal structures, including the kidneys, suprarenal gland, abdominal aorta, inferior vena cava. All these are retroperitoneal structures. Here is some information related to the kidneys. The kidneys is located in the lumbar region of abdominal cavity, and it's retroperitoneal. It's found on the paravertebral gutter on each side of the vertebral column. It lies between thoracic 12 and lumbar 3 vertebrae. The right kidney is, as you see here, is lower in position than the left kidney, because here is the liver which can press the kidney down. So the left kidney usually higher than the right by about half inch. The size of the kidney, here is the dimensions, 12 by 6 by 3, and contain 1 to 4 million nephrons. Each kidney has, as you see here, has upper pool or upper end, lower pool or lower end. It has lateral border. It has medial border, and at the medial border here you can find the hilum, the area where the renal vessels enter or leave the kidney, of course, and also where also the ureter also leave. So here is the renal hilum. Sorry, it's found at the convex medial, at the concave medial border of the kidney. Also, the kidney, as you see here, it has anterior surface here, and of course, it has posterior surface which can on the opposite side. If you look to the arrangement of structures here at the renal hilum, you can find here the renal vein is the most anterior, then renal artery posterior, then the ureter here is the most posterior. So means vein, artery, duct. The duct is the ureter. So this is the arrangement of structures from anterior to posterior. So that's important to know. Okay. So also, if you look here, you can find something interesting here. You found the left renal vein here, left renal vein, okay, is longer than the right, because inferior vena cava here is on the right side of abdominal aorta. That's why the left renal vein is longer than the right, and that's advantage when we mobilize this kidney, for example, for renal transplantation. Also, if you look here, you found that this left renal vein here is compressed between this artery, which is superior mesenteric artery, or SMA, and abdominal aorta. And this looks like the vein is sandwiched between these two arteries, like nutcracker effect. So this may compress the left renal vein, inducing what's called nutcracker syndrome or left renal vein entrapment syndrome, which may affect the left kidney, inducing renal pain, and also renal ischemia, maybe also passage of blood to the urine, or called hematuria. If we go here, relations of the kidney. So here is again here is the vat, as I mentioned before. Relationship of the kidney is important because if you look here, the kidney, of course, has anterior relations and posterior relations. So posterior relations is, before we go to the relations, I would like to mention something that that here is the again, here is the external morphology of the kidney and also the internal morphology. As I mentioned, here is the superior pool, here is the inferior pool, or you can say upper end and the lower end. Here is the convex lateral border. Here is the concave medial border here. And here is the hilum and structures which form the hilum, or within the hilum, the renal vein, renal artery, and the ureter. The ureter here, as you mentioned, you see here, the ureter here is dilated here. And this dilated part of the ureter is called renal pelvis. So what is renal pelvis? It is the dilated upper part of the ureter. And it could be inside the kidney or could be outside the kidney. It could be intrarenal, it could be extrarenal. The area where the ureter enters or hears the kidney or leaves the kidney, it's called renal sinus. As you see here, the ureter here divide into what's called major calyces or major calyces. Here is one. I mean, here is a renal pelvis or upper dilated part of the ureter divide into major calyces, one here, and one here, and one here. And every major calyx divide into another minor calyx. Here is a minor calyx, here, one here, and one here, one here. So anyway, that is the internal structure. That's the internal structure of the kidney. So when you have to cut the kidney longitudinally by knife or by scalpel like this to see the internal structure. As you see from internal structure, you found that this area is called the cortex. You found this dark area here, and this dark area is called the medulla, which contains the renal pyramids. Here is the renal pyramids here. And this pyramid has base and apex. And at the apex of the renal pyramid, you can find the renal papilla. And opposite the renal papilla, you can find the minor calyx. In between the renal pyramids, you can find here renal columns. It's part of the cortex. I think that's enough for internal structure. Let's go back again to the relationships. As you see here, here's the kidney right and left. But the posterior relations of the both kidneys are same. Of course, posterior relations of both kidneys are structures deep to them. Structure deep to them, of course, are the neurovascular and the muscles on the posterior abdominal wall. For example, what's posterior to both kidneys here? You can find these muscles. You can find the diaphragm here. You can find the muscle here called quadratus lumborum, psoas major, and psoas minor. You can find some nerves from lumbar plexus, like, for example, iliohypogastric nerve here and ilioinguinal. You can find also subcostal nerve and vessels. All these are deep to the kidneys, and of course, they are important surgically because sometimes when you make operation on both kidneys, for example, you may damage the subcostal nerve because it is deep to the kidney. when you do, for example, when you try to access the kidney from backside or extraperitoneal approach. That's posterior relation. Anterior relations are different in both kidneys. If I ask you, that's right kidney, right? So if I ask you, of course, the relation, the upper end of both kidneys are related to this gland. What is this gland? This is the suprarenal gland or adrenal gland, okay? That is the upper part, or upper superior relationship of both kidneys. But anterior relations, for example, which organ is here, for example? Here is the liver. So here is the area of the liver. Which organ is here? And it's C-shaped. It is the duodenum. So that's area for anterior relation. Here is the duodenum, second part. For example, if here, what's loops here? Here is the loops of small intestine. Which organ here? Of course, it could be right colic flexure or hepatic flexure of the colon. On the left side, it's different. Anterior relation is different. As you see here, here is a spleen, so it's anterior to the upper lateral part of the kidney. For example, here is the stomach, of course, here, stomach here. Here is the area of, here is the pancreas. So all these organs are anterior to the stomach. Also, for example, here is the small intestine, again here, and here is the colon. Here is the descending colon, and you can also, descending colon also is anterior to the lower lateral part. So that's anterior relation. It's very important to know this relationship, because if you want to access the kidney from intraperitoneal or transperitoneal approach, you have to face these structures. And when you try to access the kidney, for example, on right side, you have to take care not to damage the duodenum, because it's retroperitoneal structure here and it can be damaged here. For example, when you try to access the left kidney, you have to be careful not to damage the pancreas, because it's very closely related to the anterior surface of the left kidney. That's for anterior relations. So here again, a summary of the posterior relations, as I mentioned before, muscles and nerves, and also here is the lumbar approach or extraperitoneal approach. From here is the kidney here, right? Here is the kidney. So when you try to access the kidney from here, it's from backside or posterior approach, you have to access the kidney, you have to remove, or you have to divide or these muscles, like for example, quadratus lumborum, and also transverse abdominis. Also, you have to cut or divide the renal fascia and the pre-renal fat, which covers the kidney from backside or from posteriorly, to access the kidney here. And this approach is used for removal, for example, of large stone here in the kidney. So that is the approach used for accessing the kidney from backside or posterior side. And of course, some surgeons do, for example, they fracture the last rib to get more access to the kidneys, because the last rib, the kidney is related to the posterior to the last rib, for example, here, as a posterior relationship. So the last rib here and also subcostal nerve and subcostal vessels may be damaged during this approach. And if the subcostal nerve is damaged, it will lead to the weakness of the muscles of anterior abdominal wall. Here is the anterior relations. I think I mentioned before. Here is the right kidney, and here is again, here is the right kidney anterior relation. So it's this area for the liver, area for the duodenum, as you see here, duodenum here, okay, and here area for the liver, okay. For example, left kidney here. Here is the impression for pancreas. Of course, the spleen here is not shown. So here it's important to know these relations. For example, we can bring question in the exam, and for example, bring right kidney and ask, for example, ask here, which organ is related to this area, or left kidney, ask here, which organ is related to this part of the kidney. You can say pancreas, or if you ask here, you can say stomach, or if you ask here, you can say the spleen. That's all for the relationship. And of course, this could be impressions. I mean, this hepatic impression, that is splenic impression, that is gastric impression, and so on. Here again, it is the same. Here is the anterior relation, that's beautiful slide. And here is the posterior relationship. It's a very nice slide. I recommend you to study it very well. Okay. Here is an intraperitoneal approach to the left kidney. So it means we have to access the kidney from anterior side. So we have to open the abdominal wall, anterior abdominal wall, and open the peritoneum to reach to the kidney. And this is important approach if there is cancer, for example, cancer kidney, or if we do the renal transplantation, usually we do transperitoneal because we should access the kidneys through the peritoneum. So we have to peel the parietal peritoneum, and of course we have to retract all these organs which cover the left kidney, like spleen or pancreas, also the stomach. Of course, to arrive at the left kidney, we have to divide the lesser omentum. We have to divide the lesser omentum, which or greater omentum, and reflect the stomach upward to reach the stomach bed or lesser sac, and then peel the peritoneum in the lesser sac, because this area here is the lesser sac, and then after that we remove the peritoneum of this lesser sac to reach this kidney, left kidney. And this also approach is important when we do what's called Warren operation, or operation of anastomosing the left renal vein with the splenic vein. Here is the splenic vein here, and here is the left renal vein. So we make anastomosis between left renal vein and the splenic vein, and this anastomosis called the lieno-renal shunt or lieno-renal anastomosis, which help to decrease portal hypertension and treatment of esophageal varices. Here is the renal covering. As you see, the kidney is fixed on position by certain layers of fat and fascia. So here is from outside, here is outer side, here is inner side. Okay, so from outer side you can find the paranephric fat or renal fat. Nephric means the kidney. Here is the pararenal fat, and then you found this layer of fascia. We call it pre-renal fascia, and this fascia has anterior layer and a posterior layer. The anterior layer here, the anterior layer here is called Grotta fascia or fascia of Grotta, and the posterior layer here is called Zuckerkandel fascia. After the deeper to this fascia, you can find another layer of fat called pre-nephric fat or pre-renal fat. And finally, you can find here the renal capsule. So all these factors, or this fatty fascial layer, help to fix the kidney in position. And it's important. If this fat is lost, for example, in case of some people who are starved to decrease their body weight, maybe sometimes the kidney drop down. It's called ptosis of the kidney. Also, the kidney is fixed in position by the renal pedicle or renal vessels. The blood supply, as I mentioned before, the blood supply of the kidney, his arterial supply is the renal artery. Okay. The renal arteries arise from here, from the here is the right, left. Here is the one left renal and his right renal. It arises from the abdominal aorta. This abdominal aorta here at the level of disc between L1 and L2 vertebrae. You can say L2 because here is the superior mesenteric artery at level of L1, and here is the celiac trunk at the level of T12. So the renal arteries arise from abdominal aorta and supply both kidneys. Sometimes the kidney has also additional blood supply. We call it accessory renal artery, which is a variation, but it's not a variation, it's common variation. It's about 30% people has this additional or accessory renal artery. Accessory, it's important. Accessory renal artery. The renal artery, if you look here, it divides into branches. These branches divide the kidney into segments. So here is branch. So this upper branch is called upper segmental artery. This lower branch is called lower inferior segmental artery. And this branch is called anterior inferior segmental artery. And here is also posterior segmental. So this means that the kidney is divided into segments based on these branches. And these branches of the artery are around 5. And these branches are in the arteries. So here is the segments of the kidney: apical, for example, posterior, anterior-inferior here, anterior-superior here, anterior-inferior here, okay, here, and also this is the inferior segment, okay, this one. So anyway, just why it's important to know that, because sometimes these arteries become blocked or obstructed, so it will be there is damage to one segment of the kidney, so maybe we can remove one segment only. We call it segmentectomy or removal of one segment. That's important clinically. Renal veins, as I mentioned before, there are two renal veins. The two renal veins of the kidney drain into, here is the left renal vein, here is the right renal vein. Renal veins are drained to the inferior vena cava. Also, if you look here, as I mentioned before, left renal vein is longer than the right, and the opposite for the artery. So the left renal artery is shorter than the right. This is because the position of IVC2 here, IVC2 the abdominal aorta, inferior vena cava to the right side of the abdominal aorta. If you look here, you found that here is the left renal vein. The left renal vein receives two veins, one from above and one from below. The one from above is called the left suprarenal vein, which drains the left suprarenal gland. Here, the left suprarenal vein. And the one from below is the gonadal vein, which come from gonads, either testicular or ovarian, and drain to the left renal vein. So it means that the left renal vein receives two veins, from above and from below. From above, the left suprarenal vein, and from below, the left gonadal. That's regarding the veins of the kidneys. As I mentioned, the left renal vein can be compressed by superior mesenteric artery and abdominal aorta, and inducing what's called left renal vein entrapment syndrome or nutcracker syndrome. Lymphatic drainage of the kidneys related to para-aortic lymph nodes, which are close to the renal arteries. Innervation of the kidney from renal plexus, which is derived from celiac, is parasympathetic and also contains sympathetic fibers from T10 to L1. As I mentioned, the kidney is divided outer cortex and inner medulla, and the inner medulla is divided into medullary pyramid.